Hello, and welcome to the American Massage and Chiropractic Conference pre-conference broadcast series on One Concept Radio. I'm Felicia Brown, and I'll be your host for this interview and series. This is one of several broadcasts with the presenters and experts who are appearing in Atlanta, Georgia, May 17th through 19th, 2013, and who are brought to you by One Concept. I'd like to take this opportunity to thank the 2013 American Massage and Chiropractic Conference sponsors, Massage Warehouse Script, MPA Media, ABMP, BioFreeze, and Massage Envy Careers for making this year's event possible. Our special guest today is Pete Whitridge. Pete and I will be talking about his 3-hour class, Therapeutic Strategies for Surgeries, Scars, and Burns. But first, let me tell you a little about Pete. Pete Whitridge has been a licensed massage therapist since 1988. He teaches myofascial components of pain workshops throughout the Southeast, as well as Florida law, ethics, and business building classes. Pete completed a 4-year term on the Florida Board of Massage Therapy, serving 2 years as chairman. Pete is a faculty member of several massage schools and is a frequent speaker for FSMTA chapter meetings, as well as AMTA, FSMTA, and FCA conventions. Pete received the Charles Canfield Award from the FSMTA in 2004 for service and dedication to the massage profession. Pete is currently the president of the Alliance for Massage Therapy Education and has dedicated his career to helping establish high standards in massage therapy education. Pete, welcome to the American Massage and Chiropractic Conference pre-conference broadcast series on One Concept Radio. Thank you so much for making time to talk with me today about the event and, of course, about your class.
Thanks, Felicia. I'm so glad to be here today.
Well, I'm really interested in learning more about your unique topic. I know it's going to be a big draw at the conference, but before we get into that, I do want to get your thoughts on the idea of creating community. Part of the focus at this year's conferences is the idea of creating community by adding a community room where attendees can actually visit with speakers on a more personal level and learn more about how they can make a real difference at home and in our profession. So, Pete, what I want to find out from you is, why do you think it's important to create community in the massage and healing arts world, in our practices or businesses, and at the conference?
Well, that's it. I love the concept for that. The massage therapists usually are working in single rooms and having many, many clients during the day and during the week. And so being able to network and be together as a community is really a wonderful bonding experience. A lot of times people need to share body work, and so it's nice to get your hands and your back and neck and shoulders worked on if there were some massage chairs in that room, or just to sit and be with somebody else who goes through the same things you go through every week.
Without
really
a doubt.
Yeah.
Without a doubt. And, you know, the idea, one thing that I have just come up with again and again as I've talked about this with the different speakers is just how valuable mentoring is in our profession. And I think back to the first people that I worked with and what mentors they were for me, and realized that without their guidance, I probably wouldn't be the success that I am. And
it's so great for the younger therapists to meet people who are much more experienced and have gone through some of the business building and practice building things that need to happen. I know for me, I still see people who have been in the practice for 40, 45 years, and they have such a vitality to them. You know, they love to massage people, and they love to share their love for massage, and to take a couple folks who've new in the profession or even 10 years into the profession, mentoring is really a big piece of what we need to do to help people have longevity and maintain a steady practice. I think it's great.
Most definitely. And I want to encourage people listening and people that are at the conference to think about how they, too, in turn, can be mentors. It's not just the folks that you see teaching and, that you come to learn from, but it's you as well. That we all have something valuable to contribute. And I learned so much from the people in my classes when I'm teaching that, I think sometimes folks are surprised. They don't even realize that their experience is as valuable as it is. And I'm hoping that this is going to really stimulate new mentors to come forth and for people to realize what kind of an impact they, too, can have on our community.
Right. Well, and Felicia, I always notice that in my classes when people are there and you have a couple of new students in the class, that connection, that lifetime connection can really be stimulated by, sharing body work and learning in a learning environment. And, people are always hesitant to step forward and be a teacher. I think we all have the opportunity with our clients to teach people, and then we get to help each other as well.
Absolutely. Well, Pete, I'm dying to get into this topic because it is something I've really never heard much about. So why don't we just start by you giving a little bit of background about how and when you started working with scars and burns?
Sure. And I want to mention that Eric Dalton's newsletter came out yesterday, and he was sharing some wonderful information that they were learning at the Fascia Congress in Vancouver. So I think it's a really timely topic. I think it's something that we as body workers and people who are working with older populations, people are getting knee replacements and hip replacements, and so it's such a new part of the practice that I want people to really start to dive into that and really pay attention to, that connective tissue where it may have some adhesion or some place that's sticking in the tissues. I actually started working with somebody who had an open heart surgery very early in my practice, and it was pretty amazing to have the person actually want me to work on their scar, on the center of their chest. And one of the things that happened was that he was not able to actually wear a dress shirt because his scars would weep. They actually were putting out interstitial fluid out onto his clothes. So it was very distressing for him.
Wow.
And even as I talk about it, even many years later, it's always an emotional kind of tissue that people sometimes shy away from working on because it's in places that make people vulnerable. And so truly what happened after a few sessions, the tissue started to heal up.
Wow.
And so that really gave me some insights.
So let me make sure I understand this because I'm not sure I have a clear picture. So this person that had open heart surgery had a scar that wasn't healing. It's not just that it was uncomfortable or sensitive or that they were self-conscious about it because it was ugly, but it was actually leaking fluid.
Yes.
And you were able to massage on the tissue to help it heal.
Well, in this case, because it was kind of weeping tissue, I actually put gloves on.
Right.
And we actually just began to manipulate the tissue around that. And it was, it was really just a few very simple treatments, and all of a sudden that inflammation in the tissue stopped putting out that interstitial fluid. It was stunning to see, this is really living tissue. And,
wow.
and to me, that's the key to this. It's part of our body. And so it's more collagen than anything else, not so much muscle or anything. So it's very interesting tissue to work with. I was also inspired by one of my students. Her name is Nancy Keeney Smith, and she actually has some tremendous scars on her body. And one of the great pieces that I learned from her was that, the client can actually start to manipulate the tissue themselves. And that training and that learning of like, oh, look, it's okay to touch this. That's really important.
Wow, I guess so. I mean, I hadn't really thought about the self-care side of things. As I said, this is such a new topic for me. I haven't even really had time to think about what it would entail or require. Was there a particular kind of client or type of client that required you to do more research on the effects of the manual therapy that you were doing on this type of scar?
Yeah. Well, so for me, it was really folks who had burns. The grafting and how the tissue repairs itself and how it actually grows back together to create more epithelial tissue, or in the case of very extensive burns where they grow the grafting material together. And so that kind of tissue and how the growth hormones respond and the different stages of healing were really a piece that fascinated me. And I've always been an anatomy teacher, so when I always taught about tissue repair, it was kind of, oh yeah, and this is tissue repair. And then I started seeing people who would get a hip replacement or they had been burned. And so then I could actually talk to them about, well, look, if we're still in this stage of the healing where these growth hormones are, we want to support the tissue by doing functional movements. And then as the tissue gets more repaired and more epithelial tissue comes in, there's different growth hormones. And then we can stimulate remodeling so that it actually works in the correct direction. It's very fun. It's one of those things where the person actually can watch their scar transform.
I'm sure that's exciting to them as clients, especially if it's something that they're nervous or self-conscious about, or I guess even painful.
Well, yes, painful is one of the big things because you're not actually able to move the leg, let's say, if we had our knee replacement, and what if we began to be able to have that function to really get up out of the chair and, use our new leg that we were hoping to be successful with. There's clients who are 60, 70, 80 years old who think that, oh, my knee's been bad, I'm going to go get a replacement, and then everything will all be good.
Right.
So the physical therapy that people get and the rehabilitation that people get doesn't quite teach them that they could really take care of this tissue themselves. A lot of times people are told to be careful of their scars. You've probably had clients who had cesarean sections, and for many of them it's kind of an embarrassment or a place of kind of shyness. And when women actually start to work on their C-sections themselves, they realize, wow, this tissue can actually mobilize, and then I can actually have different movements. So it's really, it's to me, as a body worker, I love to help people learn about the connective tissue, and then when we run into a place where, oh, here's a scar, or you had a car accident, or you had a trauma, for me, it's such an honor to just work with people and let them touch that scar, teach them about that scar.
Yeah, I'm thinking, I often try to explain to students, in particular when I'm teaching ethics, talking about boundaries and creating that safe space, that therapeutic container, that people are coming to us naked in a lot of different ways. It's not just without clothes on. It's really about exposing their vulnerabilities and exposing hurt and things that they feel uncomfortable about. But a scar, just that amplified, and wow, I'm really kind of taken aback by this topic. I'm so excited to talk to you about this, Pete, because it really is, it sounds just amazing.
Yeah, and it's the thing that's so fun to teach a class like this is I get to remind people that scars are really living tissue. And when you kind of get that into your mindset, like, oh, yeah, this is collagen fiber. Fibroblasts build collagen fiber. And if I need to remove some of it, I can activate the healing and remodeling form and begin to take up some of that collagen fiber. In Eric's newsletter yesterday, one of they do some ultrasound monitoring of the tissue to kind of just see what it's looking like and how it moves. And so there was a researcher who was doing some manual therapies and using the ultrasound to look at the tissue while it was being treated. And lo and behold, we get to actually see on the films that we are actually aligning the connective tissues, aligning the collagen. So I'm really hoping to kind of share that with people as well. I've actually connected with a lady who does ultrasound testing, but she also can do thermography. And so it'd be very interesting to be able to see and sense with the heat or possible heat changes what the tissue can be visualized as. So that's another piece of information that I want people to see is like we can actually start to actually document what might be happening in the tissue.
Sounds like you need a 3-day class, not a 3-hour class.
Well, Felicia, this is taught in a 2-day format, and then my friend Nancy Keeney-Smith, she actually teaches a 3-day class where they actually go and work with burn patients. So it's really, as a body worker and as we progress this thing, so many people in our age groups have scars. Mm-hmm. And in the hospitals, they don't teach people to do the self-care. And so people are afraid of their scars. And so what I'm hoping is as body workers, when we see a scar on our clients, we don't go, oh, too bad you have a scar. We go, oh, I'm going to help you with that. I'm going to teach you about what that looks like. And so I kind of call the folks who come to my classes and who learn about scars, we call ourselves scar dogs, because we find those scars, and then we become interested in them. And, and sometimes clients don't really want to work on their scars. They're coming in to relax their shoulders. Right. But at least we can open up the door and say, wow, that's an interesting scar. Maybe you could tell me the story about that scar.
Mhm. Yeah, it sounds very intriguing. Well, as we're getting into this, I know that there are questions that people listening have and want to know more about it. So one thing I want to, find out is like what's really important, or the most important thing when you're working with scar tissue.
Yeah, I think that's a great question. And to me, you always want to be safe. So I don't work with really fresh scars. People who still have stitches in, people who still have some kind of bandaging. I'm usually not working with that type of client, although I do have colleagues who work in hospital rehabs and, they are playing with that. But most of the people who come to me have got a closed scar, so that it's been healed, and what they're really looking for is range of motion and functional movement. Okay. And then I think the other most important thing is that you don't want to try to make the scar go away. I think that, slow few times touching into its place and then leaving it alone for a while so that you're actually treating it like living tissue. Putting some more blood in there, getting some more oxygen in there, taking away some of the metabolic wastes. That in itself will stimulate the tissue, which has its own DNA and its own structure, to be able to just start to be used in a different way. So, I'd say it's, to remember, it's living tissue.
Right. Well, that's a good point.
It's living tissue.
I think a lot of people probably do think about it as, well, it's just scar tissue.
Yeah.
It's kind of like this other non-entity, and I think that's a really good thing to remember.
Yeah.
Now, you mentioned you don't like to work on fresh scars or people with stitches. Is there, a rule of thumb about how quickly therapists can begin to work on scar tissue?
Yeah. So now, I'm going to say this as if I was not working on a family member, but here we are as body workers. If the skin is not healed, it's probably not really the right place for us to be doing this work. Right. So I would say 6-10 weeks after a surgery is a very good time to start. If I was working with my mother or my wife, I would be working on that scar from day one. Not necessarily on the scar, but on the tissue around the scar that the scar is related to. And I would be working with the limb or the part of the body that is affected, so that we could have sliding surfaces. Mm-hmm. That's the nature of connective tissue, is that it's fluid. And what happens when something is getting repaired or splinted is that there's not a lot of range of motion. Right. And we see this in the hospitals, right? After somebody's had an open heart surgery, we get them up out of bed and have them walk down the hall. So there's lots of evidence that shows that we need to do this motion. But the most common person you're going to see is your massage therapy client who's had a hip replacement. They went for the hip replacement after being with you doing massages and realized, wow, I've really got a lot of degeneration here, and when I get done, I want to come in and get some treatment from you. And, I would tell that client, let's have your tissue fully repaired. Let's look at, 6 weeks, 10 weeks after you've gotten your repair, you've been through your rehabilitation, you're back at home. Let's start to do some treatments.
Yeah, and I'm curious, are you doing much communication with, like in the case of surgeries or dealing with burn, graft, that type of thing? Are you doing much communication with their medical team, or are you kind of...
Yes, absolutely. There's a variety of... I live in Fort Pierce, Florida, and so there's a couple of good hospitals here, Martin Memorial, where they actually employ manual therapists, people who are PTAs who've gotten a massage therapy license, or they're massage therapists who have been nurses, things like that. And so we definitely have kind of a network of, this person's coming out of rehab, and this is what we're doing, and then I feed that back to them. When you go back for some rehab or you're doing some physical therapy over the next 20 weeks, let's identify where we're getting stuck.
Fantastic. I think that's important to know that and to have that understanding that there is that communication and I guess collaboration in a sense.
Well, yeah, and even in old ones, like I've got a gentleman that I worked on who was 72, and he loves to play golf, and he goes and sees his doctor. And so when I work on him and I say, tell your doctor that we worked on your scar and tell him how it feels, because then the doctors learn that, not just after the surgery, but even 10 and 12 and 13 years afterwards, that they can keep the range of motion and the function.
Right. Fantastic.
That's the amazing part.
So with all this amazingness and all these wonderful things, and I'm like, ready to just go pounce on someone that has had some kind of surgery.
Yeah.
Actually, in particular, my husband had thumb surgery about a month ago, and I'm thinking, I wonder if it was for a nerve issue, though, so it's really sensitive, so I'm not sure he'd be excited about anybody rubbing it. But
yeah.
I'm curious about contraindications. What contraindications are there for working with scars and burns?
Yeah, so there are infection contraindications, right? Lots and lots of times the skin itself is an immune system response. So when we're working there, we definitely have to be sure we don't have any open sores, little nicks and cuts on our hands. So definitely all of the pieces around hygiene for our hands. If we're feeling sick, I definitely would feel like I would want to delay a treatment with either the client, or if I was sick as a therapist, I would want to delay treatment. And then most of the time, what I see as a contraindication is that people work too deeply. They try to actually kind of work so in deep in the tissue because maybe the person doesn't have many nerve endings, and so they can't really feel very much. So to me, it's a much lighter work. We might start at the surface where the superficial fascia is, and try to really gently melt that. So depth is also, speed and depth are definitely contraindications for sure. And then anything that's open, anything that has kind of a unhealed look to it. For instance, my father-in-law had a foot surgery and he was diabetic, and it never really healed up. They never really got the epithelial tissue to grow back.
Right.
And so, to me, unless I was really working in a center where I was doing wound care and I was doing support for people who had burns, I would just kind of try to refer that to somebody who's more expert. There are lots and lots of nurses out there who do wound care. There's a lot of PTAs who know how to do wound care. That would be something I'd look out for.
Fantastic. Is there And is there any particular skill or background level that you think is important for someone to do this type of work or take your class?
Yeah, that's a great question, and I love to introduce anybody to who's whether you've been a 25-year therapist or you've been a 6-month therapist, that quick reminder of what's this scar about. So there's not really a big skill level. What people have to do is they have to really be willing to work gently. Like this is not a vigorous type of massage. It's a very kind of quiet and subtle type of massage. So slowing the hands down, feeling how the connective tissue feels, those are really more important qualities than, I can palpate this bone, or I know where that subscapularis is.
Okay, well, good. That says a lot. I mean, that's helpful because there's some people out there, new or old alike, that maybe their anatomy is a little rusty, and that's what they're thinking. Oh, this is too technical for me. But
no, it's if you're touching bodies, this is the kind of sessions that a lot of people are actually looking for. I finally found my kind of massage that I like to do. And really, to me, that goes a lot to in what I actually teach in a lot of my other classes, which is myofascial therapy. We're, instead of really compressing the tissue, we're paying attention to how the fascial tissue, the flow of the tissue and where its directions are.
Fantastic.
So it's kind of an extension of that.
Okay, well that makes a lot of sense. Pete, tell me, people are going to come to this 3-hour class in Atlanta. What are they going to take away from it?
Yeah. What I think they're going to take away is a great appreciation for the human potential. I'm going to show some video of what scars really look like. My friend Gil Headley has some beautiful video that he's created from some unpreserved cadavers. So I think human potential. I think that the subtle skills of really picking up the scar and bending the scar and really trying to help that tissue begin to go back into that remodeling phase. And then I use ice a lot when I'm doing a scar treatment. So I'm actually going to bring ice into the room and really help people get clear on why we're using ice. So many people use it on such a long duration, and I use it for just maybe a minute and get the capillary beds to close, and then work the tissue again and get the capillary beds to open. So I think those 3 things are big.
Well, it sounds like it's going to be a super interesting class. I sure hope that I can get in there at least to poke my head in the door and listen for 5 or 10 minutes in between all the other things I'll have going on. And I know that it's going to be a packed class. In the meantime, though, there are some people that are going to want to get in touch with you sooner and aren't going to want to wait that long. Or maybe they're not going to make it to the conference, but they're really interested in other classes that you're teaching. So could you please share your contact information, website, or however people can reach out to you and learn more?
Sure, absolutely. So the best way to get a hold of me is by email, and my email is justaskpete@mac.com. And then people can actually contact me by phone. I actually answer my own phone, 772-332-6116. And then where I teach is called the Florida School of Massage. And so if somebody wanted to get some more information about me, they can email me at floridaschoolofmassage.com, and they'll get through to me that way.
Fantastic. Well, I'm so appreciative of you taking time to share this information. And I just know that after today's broadcast, everyone listening is ready to come to the conference and register for your class, Therapeutic Strategies for Surgeries, Scars, and Burns. Pete, thank you again for taking time on your busy day to talk with me today, and, of course, for choosing to be a part of the 2013 American Massage and Chiropractic Conference. We're so honored to have you at this year's event.
Yes, well, I'm really looking forward to it, Felicia, and as president of the Alliance, we'll be having a booth there, and I'm really excited that to get to work with One Concept. It's really a great group of folks, and I'm really looking forward to being in Atlanta. Atlanta is one of my favorite towns.
Yeah, well, it's going to be a hot time in Atlanta that weekend. We're going to have a great time. And with that, Pete, I'm going to switch gears. I want to just take a moment to let everybody know how to get involved in the conference because you don't want to miss it, people. It's going to be amazing. With classes like this, I'm telling you. The American Massage and Chiropractic Conference is one of the largest exhibitions of massage and chiropractic products, continuing education, and business opportunities for practitioners of both disciplines. This year's conference will feature over 100 exhibitors, continuing education classes of 1 hour, 3 hour, and 1 day workshops, including Pete's. Other events during the weekend include Friday night's famous Facebook meet and greet, where our theme is disco, and then the One Concept Gala on Saturday night. The new conference value pass is just $87 and includes access to all 1 hour CE presentations, the trade show, contests, events, community events, and more. And this year, we are also introducing the new One Concept Pass, your ticket to full conference access. The One Concept Pass is just $349 and $299 if you purchase early. It includes full days with James Wislowski and Eric Brown, all 3 hours, including classes with Pete Whitridge, Whitney Lowe, Aaron Mattis, Tina Allen, myself, and all 1 hour presentations. All continuing education is approved by the by the NCB, TMB, and the Florida CE broker associations, and CEs are included for chiropractors. Also, the One Concept Pass covers lunch each day, as well as access to the trade show, the chance to participate in special events, community opportunities, and contests with literally thousands of dollars in prizes. For students, the conference offers a free student day and Smart from the Start program on Friday, May 17th, which is sponsored by Massage Envy, Massage Warehouse Script, BioFreeze, and Bon Vital. This day is dedicated to massage and chiropractic students who are currently enrolled in school or who will graduate in 2013 and includes access to our opening session and the trade show on Friday. All of this is happening at the Sheraton Atlanta, and I definitely suggest you make plans to stay there if possible. Single or double rates are $129 a night, but space is limited, so make your reservations now. Also, MPA Media is printing the American Massage and Chiropractic Conference event program inside their magazines, Massage Today, Dynamic Chiropractic, and Chiropractic Insights. These will be given out at the conference and distributed throughout the U.S. to over 133,000 practitioners. So if you are a vendor or educator who's listening in today and you want some great exposure for your class or product, please contact Randy Gerson of MPA Media for details on being a part of the conference program. So if you're ready to register for the 2013 American Massage and Chiropractic Conference in Atlanta, and of course to meet Pete, myself, and the other amazing instructors, just go to oneconcept.com to access the conference schedule and register online. We also invite you to stay connected with us on Facebook at facebook.com/American Massage Conference and /American Chiropractic Conference. Again, the 2013 American Massage and Chiropractic Conference is made possible by all of our wonderful sponsors. Thank you so much to Massage Warehouse Script, MPA Media, ABMP, BioFreeze, and Massage Envy Careers. This is Felicia Brown, and on behalf of everyone from the American Massage and Chiropractic Conference and One Concept Radio, I want to thank you for tuning into this edition of the pre-conference broadcast series. We look forward to seeing you in Atlanta in May. Please also consider joining us later this year for the American Massage, Chiropractic, and Spa Conference in San Diego, California in September, and the Canadian Massage and Chiropractic Conference in October in Niagara Falls, Ontario. Thanks again for tuning in, and have a fabulous day.